everyone, this is Jason with Dr. D CBD. Welcome to a special edition of the Dr. D CBD show. And obviously, right now we have Dr. D, Don Davidson, MD himself.
You got it, Jason, right here. Happy Sunday, sir.
Yep. And so we're going to be talking about the impact of CBD and what it's having on patients with a very special guest, Dr. Badii, board certified in internal medicine. If you have any questions for Dr. Badii, our very special guest, and Dr. D, go ahead and enter them below anytime throughout the show. And you can also call in live. It's on the lower left-hand corner. Call 702-763-9518. That's 702-763-9518. If you have any questions, and Dr. D, take it away.
Yeah, absolutely. So a very special show near and dear to my heart, a couple of topics. Dr. Badii is actually an internal medicine board certified physician in multiple states, and we have a lot in common that we're going to talk to you about and share. The first topic is going to be CBD, hemp, and cannabis, and how we as doctors in the United States have seen this impact our patients' lives. How has it helped them? What have they reported to us? And how have we been able to incorporate this into our practice? The other thing that is near and dear to my heart is telemedicine. So Dr. Badii and I are both physicians that have worked deeply in the telemedicine space in the United States over the last few years. And this has been something that, really has revolutionized the space, right? Whether it is with a simple platform allowing the mass market to access things like erectile enhancement pills or skincare, or have a consultation and get a cannabis recommendation, or now, as the monitoring devices become better, do more and more advanced care remotely. So Dr. Badii, why don't you start off by just kind of letting folks know a little bit about your background, right? Maybe where in the country are you from or practicing? And then, how were you able to start to incorporate CBD or cannabis into your practice, and how has it been going with patients?
Well, I graduated from George Washington University School of Medicine in 2002.
Okay, right on, East Coast.
East Coast. Then I did 3 years of internal medicine residency at New York Medical College, where they had the highest case NICS index in the country. So I've seen basically everything. And I started a hospitalist career, and I incorporated telemedicine, primary care, and subacute nursing facility care as well. I've been medical director of several telemedicine companies, MD Live, Via, several other smaller ones, but I'm also medical director for a couple of other telemedicine companies recently. But in the past
very cool.
months, what is that sound? It's not me, but it.
I got it. Let me check it. That's all right. All right, fixed it. No worries. So yeah, you're medical director of several different facilities, several different telemedicine companies. And what else were you saying?
So about 15, 16, over the past few years, as you have seen, we had an explosion of narcotic abuse since 1999 to 2013. And a lot of these patients are legitimate pain patients, and there is really nothing between ibuprofen, Tylenol, all the way to Percocet.
Nothing. There's nothing. That's it.
Nothing in the middle. You have some lidocaine and the Voltaren gel, and that's it. There's nothing else. So we're left with trying to find alternatives to treat pain without getting people addicted. Because the more you treat them, they will get addicted, and that's where medical marijuana appears, a way to treat patients with virtually no side effects of getting addicted, getting pneumonias, getting heart attacks because of addiction.
Yeah, that's right.
As research on this topic has expanded over the 10, 15 years, a lot of physicians are becoming more familiar with the therapeutic effects of medical marijuana, CBD, cannabis, and hemp, and they're incorporating that into their system. There's a huge stigma in the past because it was illegal, and they looked at it as an illicit drug that is primarily used by criminals, but that is not the case. Medical marijuana has tremendous therapeutic effects, far, far, far safer than cigarettes. Cigarettes,
absolutely,
are safer. Cigarettes are legal. It's sometimes even safer than ibuprofen that gives you ulcers.
Right.
Other
Tylenol. Yeah, absolutely. And especially now, right, that you're getting, or that doctors that, are open enough, right, to learn about these different cannabinoids now actually have a formulary almost that is developed in the United States to guide patients to try, right? I think this is probably the first year, 2020, where you could talk to patients about not only CBD, but CBD, CBDA combinations or CBG combinations. We've been in the lab making different tinctures, right, that are legal on the hemp market, right? So anywhere in all 50 states, Farm Bill compliant, that are not really psychoactive at all, but they contain a good dose of CBD, right, 50 or 100 milligrams per dropperful, and then that non-psychoactive but neuroprotective or maybe pain relieving dose of 1 milligram or so of THC. So I think that's exciting, because as folks that have worked with folks that are going to dispensaries or ordering, hemp only products, in the past, it's been kind of a one-shot treats all approach. Hey, go to the dispensary, see what they have, try some cannabis, or try a CBD tincture. And this world is really rapidly expanding. Have you noticed any thing like that as you're talking to folks?
Yes, the modes of treatment using the CBD products has expanded: tinctures, gummies, edibles, and this has provided treatment not only for chronic pain, but for anxiety that people don't want to take benzodiazepine, Valium, or Ativan, or Xanax for.
Yeah.
For insomnia that people don't want to take, sleep medicines that are addictive. Yeah. These are all very, very beneficial. And I wish, it's better late than never, but I wish we knew we were doing this 30, 40 years ago.
Well, for sure. And I think the normalcy of it is still kind of spreading across the country, right? Like for doctors to talk about, a couple milligram dose of THC as just kind of like on the formulary for sleep, right, in the hospital, instead of, right, going around giving everyone Benadryl at night when you're a resident in the hospital and people are requesting sleep meds. There's just a different shift now where I think a lot of folks are becoming more open to talking about the products, and that is allowing some real growth. And one of the things that I was a part of in California was I was here in the industry when things went recreational. And at that time, I was running EaseMD, which was one of the highest volume telemedicine services in the country or world at the time, because of all of our partnerships and links with different delivery services. And yeah, I mean, I think in California, you do see this familiarity with the product, with the user, where you'll have, a 24-year-old female or a 24-year-old guy call in and they'll be like, I need my recommendation because I have anxiety, and instead of Xanax, I will get a 2-to-1 vape pen. And, when I'm in class or in between classes and I feel like and I'm having an anxiety attack, I hit this thing 3 times and I feel great. And you're just like, as a doctor, you're like, wow, these patients have dialed themselves in. They're so exposed to the product. They know how to self-titrate. And when you think about what else they would be taking, it's just totally a smarter choice. So I think we benefit from having that normalcy and having so many people calling us. And now I think it's really exciting to see it, Dr. Badii, have swept the country, and not only CBD, but all, I think you and I kind of know where this is going, right? It's a new specialty that's opening up. It's endocannabinoids. It's cannabinoids from the plant, and it's only getting way more dynamic. What else? I think we were going to talk about and share maybe some memorable cases. Do you have any kind of maybe specific conditions or anyone that you remember that you've helped with some of these products that had some results that were kind of interesting to share with folks? I know I've got a couple I'll share too.
I know there was this one particular patient who was a chronic pain patient, and once the guidelines from the CDC changed because everybody was scared of abuse, and he was basically let go by his physician, and he was crying on the video consult. He didn't know what to do. He was He was in constant pain, multiple spinal, hips, elbows, and knees, pain due to arthritis, advanced arthritis, and he was being given a runaround and by the physicians because they didn't want to give him narcotics, and it's understandable.
Sure.
So he called basically anxious, in pain, basically crying. He didn't know what to do. He was in so much pain. And then we tried CBD versus THC, and he went back and forth to the dispensary, and we titrated it until the pain went away. And he basically emailed me later on. He was a mechanic, and he was able to work after a while, and he was able to provide for his family. Chronic pain was controlled. That was very rewarding because you relieve somebody's pain. Not only that, relieve their quality of life and their ability to live and work.
Right. Hey, and that's always one of the things in the papers. Sometimes, in some of these studies, they don't show maybe a definite like reduction in pain or something, but that kind of intangible quality of life stuff almost always goes up with people that are using cannabis in a lot of the studies. So I think that is really cool what you just said. Yeah, helping a chronic pain patient like that. And then I think, the underlying tone right there is that you did it through the power of the internet. And I think that is pretty awesome, right? Because as we expand these programs, not only am I able to help my friend who's a mechanic, just like you talked about in Vegas with some of the CBD products, but we're able to give low-cost visits to people from, rural West Virginia could call in Tennessee, the Midwest, the South, outside of Vegas, and we can talk to all of these people and share kind of the privileged knowledge that folks like you and I have, where we are so comfortable working with this just because we've talked to so many people and been immersed in the industry. I know some of the folks that I definitely remember are some folks that came through with GI conditions, right? And these were folks that had been on lots of different medications, biologics. They had tried many different things. And I always remember, just even from med school, the GI patients were always some of the patients that seemed to know their medications the most and know them well because they were so, some of them had such bad cases if they didn't manage their conditions well. And for some of those patients, they would really look for different things to help, and they would be the ones excuse me, to try different things and keep track of the dosages and find the CBD and, see if CBDA helped and look for, acidic forms or try eating raw cannabis. And we saw some really powerful results from talking to patients with inflammatory bowel conditions over time and working with some of those sorts of patients. So that was always, I think, rewarding because those conditions are, notoriously hard to treat sometimes. And when patients have flares, it's tough.
And not only that, not that just the inflammatory bowel diseases, the irritable bowel syndromes as well, which, as later on in my career, found out people were referring to it as intestinal anxiety, irritable bowel syndrome. So, and it works the same as generalized anxiety, and it helps with that as well. Some people don't have those type of panic attacks as regular anxiety, but intestinal anxiety, also known as irritable bowel syndrome, is treated by CBD.
Yeah, and then IBS, migraines, and fibromyalgia in women, right? Possibly linked to endocannabinoid deficiency syndrome. That was a big one. Another one, a topic that I think is cool to share with you, as a board certified IM doc, is the compound palmitoyl ethanolamide, which is an endocannabinoid, was brought up in just a couple of the big research conferences over the last couple of years. It's been around for a long time. Maybe you've heard of it, maybe not. But it's been combined with CBD in some research trials, especially promising for inflammatory bowel conditions. It was presented at the International Cannabinoid Research Society, not last year, but the year before in Leiden, the Netherlands. So pretty cool. And so we've actually harnessed that formula, right, in one of the products that we have. So we have a Dr. D CBD relief capsule product, and that's literally 50 milligrams of CBD and a couple hundred mgs of that PEA in a capsule. It's cheap, it's affordable. And, as a doc, one of the big things with the whole CBD thing was that a lot of the products were too expensive. to get people taking either at the frequency or the dosage that we saw, having efficacy out in the community. And I think that one's going to be cool, just for people to try something that's affordable. They can take it a couple times a day at dosages that I read about on all these papers. So, yeah, I mean, that's cool, right? Using the power of the internet to touch all of these people, Dr. Badii, and then being able to translate some of this research that we're seeing out there right into products from the plant. Pretty cool, yeah. I mean, it's pretty exciting time.
The power of telemedicine. Now, these are official AMA statements. 78% of all primary care visits can be addressed by history alone. This is an official AMA statement. Wow. 78% of all visits to the primary care doctor can be addressed by history alone. That means phone call. I mean, it doesn't even have to be video conferencing, which we do offer as well.
Right.
So, and the other 22% are virtually self-explanatory. Somebody comes in with GI bleeding or chest pain. Of course, they won't call you on the phone.
Oh gosh, I hope not.
So the percentage of people that can be sufficiently addressed and treated on the phone or on video conferencing and telemedicine goes near 90 to 95% after you remove the common sense symptoms that you wouldn't talk to somebody. I mean, if you have a nail in your eye, don't call for telemedicine.
Well, and the compliance, right, goes up because people actually will do it and they'll talk to us. So we actually probably get more data than we would otherwise sometimes because people just, they hit the visit. I know one of the things with, is always the term access, right? And that's what you were talking about is, this just lets us touch so many people. Okay, I'll share a couple of funny telemedicine stories, and then we'll kind of start wrapping it up and talk about some of the future directions and things we're excited about. What's that, Jason?
Hey, I don't know if it's your dad, Don Davidson Sr., but Don Davidson says, hi, Don.
Hey, Dr. D Sr., how's it going? Hello from Las Vegas. What's that?
Which is, what a coincidence, when Dr. Badii was talking about the issues with ibuprofen in the gut, your dad is a perfect example. He cannot take even ibuprofen at his age, but he's seen a lot of relief from CBD.
Ibuprofen at a later age with high blood pressure exacerbates high blood pressure and causes heart failure. Think about that as well. You don't have that with CBD, medical marijuana.
And there's interesting literature out there on the cardiovascular effects of CBD as well, too. So, funny telemedicine stories, guys. Let's see. So I can remember working right in the cannabis recommendation industry. And I can remember it was just like a pattern one week. We kept having these guys that were literally like, up in the end of their bedroom. I think one guy was in his attic calling in on his phone, to get his cannabis recommendation so his wife wouldn't hear him getting his weed card. It was just, too funny. But, it lets, of course, these guys were getting a substance that was so much safer than, having a 6-pack of beer every night at home. Or whatnot. And that's something that I think, even socially out here in California it's almost a thing sometimes amongst people that like cannabis or CBD or hemp, is that they almost start sticking together because they don't want to necessarily be around the folks that are into the alcohol or other stuff because the cannabis people are almost more productive. So, there's just so much interesting data and research out there on that. And even the epidemiological studies, right, Dr. Badii, you've probably read them. They show that people that use cannabis, they actually have lower BMIs than people that don't, right? Which goes totally against that kind of stereotype of, hey, you smoke weed, you're a stoner, you're not so effective, right? And then even in the research studies of how cannabinoids may increase plasticity in the brain or neuronal interactions, and lots of cool stuff.
Well, the reason for that is if you need a medicine and you take it, you do better. But if you don't need any and you take a medicine, of course you do worse. Right. These are legitimate patients with medical needs that use CBD and cannabis. Yeah. And I don't think they take that into account on anecdotal evidence. One funny story. This guy called me. I was on a VIP service for this telemedicine company, I'm not going to name names.
Right.
Famous singer.
Okay.
Called me at 3 p.m. He's
Oh.
freaking out. His entire concert is sold out. He is anxious. Okay, and he has a migraine headache. He doesn't want to take any benzodiazepines. Okay, and he doesn't want to take any narcotics because he wants to perform on stage at 9 p.m. So.
And he's calling you at what time?
At 3.
Okay. You got to break the migraine in 6 hours.
In addition to that, he's got a really bad cold and he's got laryngitis. So I had to put everything together to get this guy on the stage at 9 o'clock. So
Steroid package.
Anxiety and migraines with cannabinoid products.
Uh-huh.
I basically gave him other treatments as well, and he went on and he killed it that night at 9 p.m. He called me the next day, all thankful, I can't name names, but
sure.
Just think about that.
Yeah.
That guy and whole concert was at stake, and he had to go on and he had to go and perform, otherwise he had to cancel it.
And you had to, and you saved it through an app, probably. He probably contacted you through an app.
It was through telemedicine.
Yeah.
It was through telemedicine. I didn't have to see him. It was just on history and his past medical history and presenting symptoms. And we were able to make him functional for 9 p.m. So I actually turned on the particular channel, and it's a he. So he was singing. So it wasn't
very
a she.
cool.
So he said he.
Well, I think this is, I'll talk about some of the future kind of directions now. That's a great story. One, it's not just Dr. Badii and I, it's a whole network of doctors that we're going to all be able to interact with. Sometimes it'll be maybe one or two of us. Sometimes it'll be 3 or 4 of us all talking and hosting the show. Docs from all over the country that have been involved either in telemedicine, CBD, hemp, integrative medicine, or other progressive fields, psychedelic research, mushrooms, all sorts of really neat things. So I think everyone, one thing Dr. Badii and I want to tell everyone is, the relaunch of the platform I used to manage, which was known as EaseMD, has now been rebranded to DonDavidsonMD.com, otherwise known as Dr. D Telemedicine. So that means the web portal is open. The apps will be released this week. And so that puts the power of physicians with a lot of knowledge, like Dr. Badii, literally into the palm of your hand or into your laptop, where you can go to the website or download the app and you can talk to Dr. Badii or any of the other docs that are on the platform. And so that's pretty special, right? These doctors have a lot of experience. They're experienced with telemedicine. They're experienced with the drugs or the cannabinoids, and they are able to instantly get you that digital recommendation, which for folks in California, Dr. Badii, as you know, is actually quite valuable because it is still a patchwork of legalization in many places because certain localities will only have medical dispensaries. It helps both the dispensaries and patients save on the taxes, which are really quite high in California. And it helps. What's that? Go ahead.
It's 17% taxes that you're saving.
Yeah, it's crazy. So the medical card, if you're actually a patient that does use cannabis, daily, it definitely saves folks quite a bit of money. And, the third one, or the other point I always mention is, so for some folks that are edible patients, they have high tolerances and that they can buy higher potency items usually once they have their medical card. And then remember, the California medical card also is reciprocated by some states. So, that can be another reason to get a California card because the California cards are so affordable. And then Dr. Badii, what else? Anything else about the California cards that are kind of interesting? I know, I'm excited about getting into New York and expanding the service, but
Hey,
California is a great place to start. What's that, Jason?
Yeah, just letting you know that I put the URL on the screen. It's DonDavidsonMD.com.
That's right. So that'll be active by tomorrow. I think we're fixing some things on there tonight, so it might be paused, but that will be activated. We will be, communicating back to our original user base. So we expect quite a bit of traffic to pop up for Dr. Badii to talk to and others. So we're excited about that. And Dr. Badii, anything else just generally about telemedicine, California, doctor life to share with anybody, or what else?
In California, there are much less restrictions on CBD, hemp, and cannabis. So as a doctor-patient relationship, we have more leeway to treat the patient. In other states, it's a more stringent criteria. If you are in California, you're very lucky. In addition to the sunshine, of course. But yeah, if you're in California and you're in need of CBD, cannabis, and hemp products, you have a wider options than other states. So
that's right, and that's what Dr. Badii is getting across there, is that a lot of the other states have a narrower window of basically conditions or leeway for physicians to legally grant you access to medical marijuana. And in California, we as physicians are basically able to approve folks for any condition that is negatively impacting their daily life in any way. So that lets us treat people with these remarkably safe compounds effectively and without the need for oftentimes other things like ibuprofen and over-the-counter drugs. So I think this is a great place to kind of end this chat and set everyone up for the rest of the content that the team of doctors here are going to produce. Also nurses, we have some great oncology nurses that are going to come on over the next 2 weeks and share their experiences treating patients, mainly women with breast cancer and cannabinoids, and some neat learning points they have for everyone. And besides that, Jason, any other kind of housekeeping items before we sign off and get back to work?
Yep. If you're watching this after we go live, feel free to enter any follow-up questions you have for either Dr. Badii or Dr. D in the comments below. And sit tight, because once we sign off, I'm actually going to show a demonstration of how simple and easy it is to get online with either Dr. D or Dr. Badii or any of the other physicians to get your medical online recommendation card.
Yeah, that's right. Check that out. And then later this week, we will also have Dr. Alavi, who is part of the team, coming on. So Dr. Badii, you're welcome to join us for that talk as well. But another neat integrative medicine doctor who I've worked with for a long time, who's a wonderful lady. So everyone, thanks for tuning in. Pay attention to what Jason's going to show you. That's important. It'll show you just how easy it is to get your card here in California, your online cannabis recommendation. And then you always have our support team here. If you hit that website, there's a live chat button in the bottom right-hand corner. You can free text to our support team here. Long's always in the office. And then we also have a phone number as well as a support email.
Be sure to like, follow, share, subscribe, and we'll see you next time.
We do have a ton of content coming as we travel and basically build these brands and telemedicine systems. We are living in the industry, so it's neat to watch. It is kind of a real life American building of the industry, right, as we go. It's a cool story. And besides that, I don't have anything else to say tonight. Tune in next time, guys. It's been fun.
Thanks a lot, Dr. Badii. Appreciate it.
Yeah, right. Absolutely, Dr. B. Thank you.
Thanks, Dr. D.
Have a good night.
All right.
Bye-bye.
Dr. Davidson here, laid back visitor. All right, nothing to worry about. Let me just run through your chart. Overall, you're pretty healthy, no major medical problems or medications that you're on every day. And then just for your chart, no bad depression, no problems with drugs and alcohol, you're not pregnant, no family history of schizophrenia or anything like that. Are you pretty familiar with cannabis? So you kind of know what you like already, or do you have questions? The virtual copy of this recommendation actually will sync right into your e-account. You're also going to have the virtual copy, right, as a PDF file that you can actually just download, right out of the app on your phone or through the web. And then we're physically going to mail you that hard copy with the seal on it right out of Los Angeles tomorrow. And besides that, my friends, stay out of the rainstorm and have a good rest of your weekend. Yep. Cheers, brother. Later on.